A person suffering from a headache could walk to a pharmacy and purchase painkillers to relieve the pain. However, doctors are raising the red flag, warning that some painkillers, such as Indomethacin or Indocin, could cause kidney failure to both children and adults.
Can a pregnant mother take?
Still young. No, it's Panadol.
Sorry?
Panadol.
Very easy to get the drug, costs just only 1,000 shillings for a dose. But it's normally used for especially people who have pains in the joints and in the back. But this drug could also be very dangerous for especially expectant mothers. And of course, in some pharmacies, when you walk in and walk out, all they are caring about is money, not saving lives.
Speaking to NTV Today, Dr. Sylvia Awori, a gynecologist, said that research shows that Indocin can also affect the development of body organs of the fetus in expectant women.
We know that when this drug is given in early pregnancy, especially the first 3 months, it causes renal agenesis. It causes malformation, maldevelopment of the kidneys. It means this baby is not going to have a functional kidney. And yet this is a very cheap drug, very available.
Pharmacists and doctors have listed a catalog of painkillers, which if taken in large amounts, have dire consequences. Indocin or Indomethacin is commonly used as a painkiller, gentamicin, an antibiotic, methotrexate, and cisplatin administered as anti-cancers. Thalidomide used to stop vomiting. Often pharmacists recommend paracetamol for expectant mothers, but women in rural areas are quite reckless and often do self-medication.
So it is well documented that many drugs which are quite available in our markets can actually be dangerous to the kidneys, especially among children. And one common drug is gentamicin, as I said. Even the other drugs, including the ibuprofen, diclofenac.
According to pharmacists, most painkillers are sold openly at counters without any doctor's prescription. Indocin is sometimes used in production of rat poison.
What has been found is, especially in countries where there are proper databases for people and their health conditions, is that Indomethacin and related drugs cause peptic ulcer disease. It's the leading cause of drug-related peptic ulcer disease.
Doctors in pharmacies say almost every drug can be dangerous, especially when one takes an overdose.
In the decision, there are many factors you weigh as far as the patient is concerned, as far as the drug you want to give is concerned. Is this the only drug that the patient can benefit from? Are there safer drugs? So once you weigh those, we call it benefit-risk assessment. And you're looking at the patient, the factors around the patient, you're also looking at the drug, the alternatives, and you're choosing the best.
Although the National Drugs Authority enforces the sale of high-quality drugs in the market, many counterfeit drugs continue to flood the market.
There are promoters who come here, they say, "Doctor, if you prescribe my medicine, I'll give you 1 full tank of fuel every month." Now you ask, what's the cost of your medication? And it's probably 7,000 shillings per dose. Then my full tank of fuel is about 180,000 per month. Then you wonder why.
Pharmacy practitioners are expected to constantly carry out research on new and existing generic drugs on the market so as to avoid wrong prescription. Sudhir Byaruhanga, NTV.